Varicose veins are a very common problem in the United States. In fact, over 40 million people in the United States have varicose veins. 25% of females have varicose veins, and 15% of males have varicose veins. A lot of people confuse varicose veins with what we call spider veins, and in fact, insurance companies aren't confused because they only pay for one and not the other one. They pay for treatment for so-called varicose veins, but not spider veins. True varicose veins are veins that bulge out in the legs and actually protrude from the skin surface. So if you run your fingers over the skin, you can actually feel them bulging out of the skin. Those are true varicose veins, and true varicose veins are almost always associated with symptoms. Symptoms of true varicose veins include leg pain, typically an achy pain, leg swelling, itching, and if untreated, sometimes that can lead to chronic leg swelling, skin changes where the skin actually becomes pitted and very hard. We call that stasis dermatitis. Sometimes it can actually lead in extreme cases to venous ulcerations in the lower extremity because of the so-called venous insufficiency. So in one treatment session, we'll treat the underlying problem, which is the saphenous vein, with a laser device, and then also remove the bulgy veins with a procedure called phlebectomy. That procedure is done on an outpatient basis with IV conscious sedation. The patients are awake yet very sleepy and relaxed, and they go home following the procedure and actually are instructed to resume their normal activities as soon as possible, because instead of the stripping where patients are in bed for a number of days or even a week, we want these patients to return to their normal activity as soon as possible. The day of the procedure, we ask that they limit their activity somewhat to reduce the likelihood of bleeding from one of the small needle puncture sites. But as soon as the next day, for my patients, I allow them to resume all of their normal activities, including driving, working out, anything like that, because I want them to return to their normal activities as soon as humanly possible.